Good afternoon and welcome to today's webinar, Understanding the Aging Process, How Aging Affects Your Nutritional Status. My name is Tammy Cave. I am a management analyst and caregiver specialist on the Caregiver and Supportive Services Unit with Fairfax County Area Agency on Aging. Before I introduce today's speaker, I will go over a few housekeeping items. Today's presentation is being recorded and a link of the recording will be sent to all registrants a week from today. We have enabled closed captioning. Also, there is a Q&A button at the bottom of your screen where you can submit your questions. We are going to allocate a few minutes at the end of the presentation to address your questions at that time. This presentation is 2 hours long, but there will not be a break in between or an intermission in between. So please take a break at your own leisure. The slides for this webinar will not be shared, but we have shared a PDF handouts that were emailed and can be emailed with the recording. Last, there will be a brief survey as you're about to sign out. Please take a moment to fill out that survey because it helps us to create more webinars that are relevant and important to our caregiving community. Now, it is my pleasure to introduce today's speaker, Diane Reinhold. Diane Reinhold has been a nutrition and wellness educator with the University of Illinois Extension since June 2013. She uses her experience as a registered dietitian nutritionist to deliver innovative programs with meaningful information and strategies to inspire others to improve and maintain their nutritional health across their lifespan. Diane specializes in chronic disease prevention and management, food safety, and food preservation. Diane received a Bachelor of Science in Nutrition and Dietetics from North Dakota State University. At St. Louis University, she earned a Master of Science in Nutrition and Dietetics and a Master of Public Health and received a certificate of university teaching. Before joining the Extension, Reinhold worked as a registered clinical dietitian nutritionist specializing in medical nutrition therapy for the geriatric and critical care population. Diane is a member of the Academy of Nutrition and Dietetics and the Illinois Dietetic Association, the Association of Diabetes Care and Education Specialists, and the National Extension Association of Family and Consumer Sciences. She is a national diabetes prevention program lifestyle coach, passionate about empowering others to incorporate healthy lifestyle choices through diet, stress management, and physical activity. Her areas of interest include obesity, chronic disease prevention and management, healthy lifestyles, food safety, and food preservation. Diane, we want to thank you so much for being here. We are all looking forward to your presentation. Please take it away. Please take it away.
Thank you very much for that lovely introduction, Tammy. I just want to take a second so that everyone has a chance to see what I look like, that I am a real person and that I'm not an IA bot. So with that, I'm going to turn my camera off, share my screen, and begin our presentation. We have lots to talk about today, and this is really a topic that's near and dear to my heart. I worked in a long-term care setting for many years, and I really have a passion for older adults. And so let me just go ahead and share my slides. All right. Well, as Tammy said, I am a nutrition and wellness educator with the University of Illinois Extension. And for those that may not know, the University of Illinois Extension is a flagship outreach effort of the University of Illinois at Urbana-Champaign. And we offer research-based educational programs to our residents within Illinois and far beyond. So what are we going to be talking about today? Anytime I do a program, I like to know, okay, so someone has just asked that I'm going to give up 2 hours of my very busy schedule. So what am I going to be learning? Is it going to be worthwhile? So the things that I would like to cover today are why nutrition is important, especially as we age, as well as the changing needs that our bodies have due to the aging process. We're going to also talk about how those physiological and psychological and social um, changes impact our nutritional status. So, what are some of the common issues and nutritional issues that are going to be impacted? Dehydration, we could have difficulty chewing or swallowing. We may have chronic health conditions. We may experience weight loss or weight gain, or there could be a cognitive decline. So, we are going to be talking about those as we go throughout our presentation. So the first question is, why is nutrition important? You know, there are many things, many wonderful things and surprising things that happen to our bodies as we age, such as the loss of muscle and bone tissue, mild cognitive decline, perhaps a decreased sense and taste and smell, just to name a few things. And these subtle changes can make it much more difficult for older adults to meet their nutritional needs. When this happens, you or they are at greater risk for poor nutrition, which thus increases their risk of malnutrition, their risk of falls and fractures, and essentially overall, it impacts the quality of their life. So, with that being said, your food choices really do matter because they impact your health as well as how you feel in the future. So, good nutrition is an important part of leading a healthy lifestyle. When combined with physical activity, diet can help you to reach and maintain a healthy weight. Now, it doesn't necessarily mean it's going to be your ideal body weight, but it's a healthy weight for you, a stable weight for you. Additionally, it can help you to reduce your risk of a chronic disease like heart disease or diabetes, certain types of cancers. And again, it's going to promote your overall health. So staying healthy is and eating or having good nutrition is going to help you stay healthy. It's going to help your immune function. It's going to help preserve and maintain some of that lean muscle mass. It's going to allow you to live independently. That means you can enjoy your time with your family and friends. So all of those things you might be thinking, oh, does it really matter if, I had, didn't eat that great yesterday or today, and I'm not going to eat that great tomorrow? In the long run, it does make a difference. So treating yourself every now and then is okay, but you really have to think big picture, long term, and understand why nutrition is important and how it impacts your overall health. So the foods and beverages that you consume have a profound impact on your health. The scientific connection between food and health has been well documented for years. In fact, researchers and healthcare professionals and many others have taken time and compiled guidelines with food based recommendations to promote your health and help prevent diet related chronic illnesses such as obesity, heart disease, and diabetes. I'd be really curious if we were in person, I would ask by show of hands, how many people have heard of the term diet related chronic diseases or chronic illnesses, diet related chronic illnesses? And that's because that's kind of a newer term, and it's a term used that really hits home with nutrition and healthy eating and the consequences of not eating healthy and how they impact many of the chronic health issues that we're dealing with. So that guideline that I was talking about, that is our dietary guidelines for Americans. And those guidelines are designed to help you meet your nutritional needs across the lifespan. So it doesn't matter if you're, 3 months old, 3 years old, 30 years old, or 90. Those guidelines are there to help you. So something that I want you to think about is, as we age, healthy eating can make a difference in our health. And instead of saying our health, say my health. It helps to improve how we feel and encourages a sense of well-being. And in today's busy, crazy world, many of us are looking for that magic thing to help us with having a good sense of well-being, and realizing that choosing healthy, nutritious foods in moderation can really help with that sense of well-being. So I'm a firm believer in helping people to understand the why behind the ask for a recommendation. I can tell you, like, oh my gosh, if you want to lose 20 pounds in 30 days, what you need to do is, when it's a full moon, stand on your left foot for 20 minutes and face north. And then when you're all done doing that, stand on your left foot for another 10 minutes, but you have to face east. Well, that statement makes absolutely no sense because there's no scientific evidence behind it. And so when people know what the science is behind it, if they have an understanding of why they're being asked to do something, they're going to be much more likely to move forward with that behavior change that's being recommended. So let's start by asking, did you know? Did you know there are different stages of adulthood? Yes, it's true. There are different stages, and it's important to understand each of those different stages, because during each of those different stages, there's going to be physical changes that are occurring within your body that will make it much more difficult or easy, depending upon what bracket you fall into, for you to meet your nutritional needs. And while healthy eating is essential at all stages of life, healthy eating is especially important for our older adults because aging is linked to a variety of changes. It's also linked to nutritional deficiencies, a decrease in quality of life, and unfortunately, it's linked to poor health outcomes. Thus, we need to make sure that we're eating healthy at every age, so it becomes part of our lifestyle. And wise food choices and a balanced diet are truly the key cornerstone to slowing the progression of many of the age-related issues that we face. And it can help us to improve that aging process. So look at this table on the screen. Think about where you belong or where you currently are, and where you want to go. What is your health goal? Is one of your goals to live to be 93? My goal is to live to be 93. And because of that, I need to take all of the various steps and recommendations into consideration and figure out a way how my life can how I can incorporate those recommendations into my life. So again, you might be thinking, so why do I need to know that there are different stages of adulthood? Well, I mentioned earlier that aging is linked to a variety of changes that are occurring within our body. And some of those changes are muscle loss, mild cognitive decline, a decreased sense of taste and smell. But they're also linked to other things, such as the thinning of the skin, having less stomach acid. And we'll talk more about those later. But really what's important to know is that some of these changes that, that can occur due to aging can make you at increased risk for nutrition deficiencies, while others can affect your senses and your quality of life. You can't necessarily expect someone who is 76 years old to do the same things that someone in middle age would be doing. So someone who is, 59, they're not going to necessarily be doing the same things that a 76-year-old is doing. Their nutritional needs are going to be slightly different. Again, they're at different stages and they're going to have different health-related issues going on within their body. The changes that occur can also make it more difficult to meet your nutritional needs. So understanding where a person is in the aging process is going to really help you to understand how you can better help your loved one or your patient that you're caring for. So let's start by looking at what are some of the factors that affect aging, because there are many factors that influence aging. And although someone may have a chronological age of 60, their body might be aging much more quickly. And the converse is true as well. Aging is influenced by our lifestyle, and your lifestyle includes any choice that is made or any action that influences your life, even in the smallest of ways. Simply put, it's a way that a person lives their life. And some would even say it's an accumulation of our beliefs, our values, and our daily behaviors and habits. Now, there are many factors influencing our lifestyle, like our social economical status, our level of education, our family and social networks, but also our gender, our age, where we live, our environment. Do you live in a community that has sidewalks, that it's easy to, walk down the block and back? If you are, 62 years old and you are recovering from knee surgery or hip surgery, and if you live in an area that has a nice walking path that you can go and walk and get that exercise to help recover and rehab that joint that you had surgery on, that's going to make a huge difference compared to someone who doesn't have a place that they can go walking, like a park or a sidewalk along a street, because many communities don't have a sidewalk. So think about all of the different things within our environment that can help promote health and wellness. Think about the environment of your home. Do you have space in your home that you can practice going up and down stairs? Or have you purchased a home where you don't have to worry about stairs? Is it okay that you're outside? Or are the mosquitoes so bad that you're concerned about any of the various illnesses you can get from that? So there are many different factors that impact our lifestyle, and all of those lifestyle factors are going to impact the aging process as well as our genetics. Genetics account for about 20 to 30% of our aging process. Lifestyle accounts for the other, and therefore genetics is a factor, but your lifestyle, what you choose to do, is going to play an even larger factor. Again, our environment, do we have clean air? Do we have green spaces that we can get out and walk in? You know, in our lifestyle, do we have a family that's an active family, or is it a family that's very sedentary? Do we have good interpersonal relationships within our lifestyle? Do we have people that we can go to and share our trials and challenges, as well as our joys and celebrations with? You know, or are you struggling with depression? Are you struggling with other issues that can negatively impact your overall health and well-being? So all of these factors are going to impact the aging process. And it's very important that none of them be taken for granted. So factors that influence your nutritional needs. The total number of calories that a person needs to consume each day is going to depend on a variety of factors. It's going to depend on your age, your gender, your height, your weight, your body composition, the level of physical activity that you have, as well as your stress level. Do you have some type of infection? Do you have a wound? Do you have chronic obstructive pulmonary disease? All of those different stress factors from a health standpoint impact your total nutritional needs, your total calorie needs, as well as the types of vitamins and minerals and nutrients that you may be wasting due to medication, or that you need additional nutrients per se for wound healing or fighting off some type of infection. Most older adults need fewer calories than they did when they were younger. But here's the catch. This is the tricky part. Although you generally need fewer calories, they have similar or even greater nutrient needs compared to younger adults, which can make it really challenging. So now there are many reasons that this actually can occur. First off, older adults generally are less physically active, and there are physical changes that are occurring within their bodies, such as having a change in metabolism or age-related muscle and bone loss. Essentially, our body just does not work as efficiently as it once did when we were younger. Plus, we lose, to some degree, our ability to absorb certain nutrients. Other factors that impact our nutritional needs include any type of chronic health condition. You know, if you have chronic kidney disease, if you have a wound, if you're on any different type of medication, or if you're taking multiple medications, if you're on a water pill or a diuretic, you're wasting potassium. So you may need to take additional potassium, ideally through the fruits and vegetables that you're consuming. Do you have a decreased ability to recognize your need for fluids? There could be changes in your GI health, essentially in your gut health, that decreases your ability to absorb key nutrients. And so this is why, as we age, we truly, truly have to make every bite count. Again, if we're going to meet and get those fewer calories, but no more nutrients, we really have to make those nutrients count. In addition to the physical changes that are occurring, there's also social factors that are going to impact our nutritional status. For example, if we have a fixed income or have difficulty preparing or even getting groceries. You know, it's quite shocking to see how much our food budgets have had to go up over the just past year. And so if you're already on a limited budget, that is a huge issue that many seniors are having to deal with. As well as, are we eating poorly? Do we have difficulty chewing or swallowing? Or do we have some type of sore or pain in our mouth due to tooth loss? Or maybe we need to have our teeth pulled or our tooth taken care of, but it's just really not in the budget at this time, or you're on a wait list to get an appointment. So you're having to try and get your nutritional needs met while still dealing with this issue in your mouth. Or you could have a decreased sense of taste or smell. A lot of our ability or a lot of our appetite and desire to eat is influenced by the wonderful smells. If you walk into some of the, sub shops, you smell fresh baking bread, and that, for some just makes us want to eat more, or, dive into that delicious sandwich. There are other places that bake cookies to kind of get our attention and draw us in. We could also have issues, physical issues, difficulty preparing food. If we have rheumatoid arthritis, or if we've broken a wrist or finger, we can have decreased mobility and not be able to cut and slice foods. Or perhaps we even need assistance with those simple skills, such as, cutting our food or transferring a plate from the countertop to the tabletop. All of those small things can make a huge difference and impact our ability to get the nutrients that our bodies need, because sometimes it's just too much work. And you're like, making lunch is just, it's too much. I'm just going to eat a cookie and call it good. And when you're, 76, that's just not good, because that cookie is not going to be giving you the vitamins and minerals and fiber that your body needs. We could have a loss of appetite, and that can again be to a loss of smell. It could be due to medication, or it could be due to depression. Even the mere thought of food can elicit some emotional response. But if you're feeling depressed, that just doesn't, you don't respond the way that you once did. And since appetite levels are greatly influenced by your brain, if you're having any issues with depression or even mild cognitive impairment, that can essentially impact your overall appetite. So again, many physiological and social factors at play, and why individuals can have issues getting the nutrients their body needs. So how many calories do we need? Now, generally, I don't like to give, information out like, oh, you should consume X number of calories, because again, it's so variable. Some people have a really high metabolism, maybe they're very active and they say that they're just somewhat active. But inevitably, people always ask me, can I have a ballpark? And so this information is from the National Institute of Aging. And, our goal as we age is to be as healthy as possible for as long as possible. And we know that in order to achieve that, good nutrition is important, but also so is physical activity. And you can never, ever talk about nutrition without talking about physical activity. So a person's daily calories, as I mentioned earlier, is going to depend on many different things, whether they're male or female, their activity level. And so here are some general ballparks of individuals for those over the age of 50 from the National Institute on Aging. And just to put it out there, that sedentary means that you're only doing light physical activities associated with your typical day-to-day life, whereas moderate activity includes activities that are equivalent to walking 1.5 to 3 miles a day at a rate of about 4 to 5 miles per hour. And then being active means that you're walking at least 3 miles a day and walking 3 to 4 miles per hour. So again, you always have to consider where's your baseline, but this is a general ballpark for individuals that are looking to maintain a healthy weight. And I generally say, most older adults really aren't active enough unless they're very active, where they need to consume more than 1,800 calories a day. So, all right. So what happens as you age? Aging is really more than the passing of time. It's a subtle and quiet process that occurs each and every day, and it often goes unnoticed. And I have to say, so I'm fair complected, and I never had freckles, but now that I'm older and have had the opportunity to be out in the sun more, I'll notice, I'll be like, oh no, I got another freckle. And then my healthcare provider is like, nope, that's an age spot. And I'm like, I'm too young to have an age spot. So I don't know if you notice little things about aging, or sometimes I'll be like, oh no, my skin's getting wrinkly. And then my friend will say, oh, my skin's wrinkly too. And I'll be like, oh, I guess we're the same age. So, maybe some people notice it more than others, but for the most part, people, don't necessarily notice the aging process because it is generally a very subtle process. But we're all getting older, and as we get older, our bodies are changing. We might be growing a little more round around the waistline, or you might find yourself waking up a little bit more often at nighttime to go to the bathroom, or you might feel a little bit more stiff than you did in the morning. If you think back to when you're in your 20s and you would be out to 2 or 3 o'clock in the morning, and you'd get up and bounce out of bed and work a full 10-hour day, and then you're like, hey, let's go out and do that again. Didn't seem to impact you too much. But now that you're getting a little older, you may be noticing you just can't do that so much. And while we adapt to the new realities, we really shouldn't discount every symptom as further evidence of aging. So let's take a closer look at some of the more subtle changes that occur during aging. So, as people age, the heart tends to enlarge slightly, developing thicker walls and slightly larger chambers. These the age-related stiffening of the heart walls can cause left ventricular that doesn't fill well, and then it can lead or contribute to heart failure. And this is especially true in older adults with chronic illnesses such as high blood pressure, obesity, and diabetes. And so, again, you might be thinking, well, how does this really impact me? Well, it used to be that a lot of times individuals didn't develop type 2 diabetes until later in life, like, in their 50s or late 40s. But we have a lot more younger individuals, people in their 20s and 30s, that are developing type 2 diabetes. And so knowing that diabetes is a contributing factor, or it increases your risk of developing cardiovascular disease, that just kind of leads you more to like, hey, I better, make sure that if I'm pre-diabetic or diabetic, then I'm really working hard to manage my blood sugars and adapt some of the healthy lifestyle behaviors that my healthcare providers have encouraged me to do, because it can snowball very quickly if we are not addressing those issues. And so again, our heart changes naturally due to the aging process. But if we have a chronic illness, that kind of like puts another risk factor in our little risk bucket. So additionally, the elastic tissue within the walls of our arteries and our arterioles can be lost. And together, these changes make the vessels stiffen and they're less resistant. And since the arteries and arterioles are less elastic, blood pressure cannot be adjusted as quickly. So when we stand up, older adults can be at greater risk for dizziness. And in some cases, they can even faint if they stand up too quickly. And so think about that when you're transporting a patient, or if you're moving one of your loved ones from the bed to a chair. And if you go too quickly, that could cause them to, again, become dizzy or even faint. And so that might be like frustrating for you, because you're like, oh, why aren't they, cooperating and doing what I want them to do? But the reality is these physiological changes may be essentially like impacting, how they react or interact. And, you might also just be thinking, okay, Diane, why is this important? And that's a great question. So an individual's ability to sustain a high level or even a low level of physical activity, especially if it's an individual that is, bed bound or has minimal activity. So for them to sustain a higher level of activity for a prolonged period of time, that's going to decrease with age, even in healthy individuals. So if you think about, let's say your mom is in her early 70s and you go grocery shopping and you get frustrated because you're in a hurry, you're taking her shopping and you want her to go faster, but she really can't. She just doesn't have the endurance. And because her heart isn't able to work as efficiently. And that this decline can be slowed, of course, by engaging in regular physical activity, but it can't be completely avoided. So if you think about your loved one that you're taking grocery shopping and they're able to walk and go, but they're not going as fast as you want them to, versus if you're talking about an individual who is in their bed and you're transferring from the bed to their wheelchair. Again, understanding the different age ranges within that adulthood and knowing where they're at physiologically, the changes that are occurring, and knowing what their physical activity levels that they can endure are, makes a huge difference. So there's that aspect. The other aspect is that, as their bodies are changing, as their heart is changing and it's not pumping efficiently, and they have fluctuations in their blood pressure, that's going to impact their ability to do those activities of daily living. Like I was talking about the grocery shopping or even preparing their meals. And if they have more than one chronic health condition that they're dealing with, that can make it even more complex. So again, thinking about where they're at. And I know that there are a lot of individuals on today's webinar that, maybe they're taking care of their loved one and their loved one is just kind of beginning the process of, really starting to need assistance because they're declining. But others that are on this call may have someone who is homebound and they're having to deal with that. So I'm going to try and throw out different examples throughout the presentation. So age-related changes in our bone. So it's important to know that bone is a living tissue, and as we age, our bones are changing. And these changes result in the loss of bone tissue. Having low bone mass means that your bones are weaker, and it increases your risk of fractures and breaks due to a sudden bump or fall. and therefore taking steps within your home to make sure that, you know, you don't have loose rugs out, or you don't have things on the floor that your loved one could trip over. Those are all very important. But when you think about it from a nutritional standpoint, you have to be very intentional about working to maintain that bone mass. You need to become active, because inactivity contributes to bone loss. You know, bone loss, our bones become less dense, and we can develop osteoporosis as we age for a number of reasons, and that includes being inactive. So being active, having that weight-bearing activity, simply walking is a weight-bearing activity, something very important. Hormonal changes can contribute to the development of osteoporosis, and it occurs in both men and women. When women go through menopause, menopause can trigger the loss of minerals in bone tissue because of the lower levels of estrogen. In men, the gradual decline in their sex hormones can lead to the later development of osteoporosis. And so it's a real issue, and it impacts people differently. But again, that aging process puts them at greater risk. And as our bones are losing calcium and other minerals, it's going to be very important for both men and women to make sure that they're consuming adequate amounts of vitamin D and calcium to help prevent or delay that osteoporosis. Overall aging, decreased activity, certain diseases, again, chronic kidney disease, and various medications can cause your bones to become weak and fragile over time. And, you know, most bone fractures occur because of a fall, and you can reduce your chance of falling by, you guessed it, engaging in physical activity, because you can build those strong muscles to help with our joints and help with our bones, but it also helps to improve your balance. And as exercise can slow the rate of bone loss, and therefore it reduces your risk of fractures. So all very, very important aspects of nutrition and wellness for the aging process. You heard me mention that, you know, exercising is good because it helps to strengthen the muscles that surround the joints. So on our screen, we have a picture of a joint. And so just think about the muscles that are around that leg bone and around that joint that are protecting it. And, you know, a joint occurs where bones come together, and theoretically, your bones do not directly come into contact with each other. There should be a cushion there called cartilage, and that's going to line your joints. Additionally, there's synovial membranes that surround the joint and line that joint, and there's synovial fluid that helps to lubricate the joint by providing that lubrication. However, this is something interesting. As you age, joint movement becomes stiffer, and you're less flexible because of the amount of lubricating fluid inside your joints. It decreases, and the cartilage also becomes thinner. And so that makes things kind of interesting. And you're thinking, really? Tell me more. Wow, let me tell you more. So, you know, these age-related changes in our joints happen for a number of reasons. You know, the changes occur in our cartilage. What ends up happening, it can become a slightly brown color, and that's due to the buildup of like byproducts naturally occurring within your body through metabolism that build up in that cartilage and then cause it to turn a brown, and then it becomes thinner and more brittle, making it much more susceptible to breakdown. And when that cartilage breaks down, then you can end up having bone surfaces become pitted and rough, and that can cause pain in the joint. It can cause irritation to the surrounding tissue and contribute to arthritis. Additionally, the ligaments that surround that joint can also shorten and you can lose some of the flexibility, making those joints stiff. So, end of the day, what do you need to do? You're right, be active. Being active contributes to being active is actually good, and it helps to prolong that joint for it being healthy. Also, from a nutritional standpoint, consuming an anti-inflammatory diet, that's going to be really helpful for your joints. So consuming a diet that's rich in fruits and vegetables and is low in highly processed foods. So, no chips and cookies and muffins and pies and things like that. No takeout foods, just having those on a rare occasion, but really, cooking from scratch and getting those fruits and vegetables in. I frequently joke that, I went to school and spent lots of money on my education. And at the end of the day, the most important thing to stay healthy is to move more. So move more today than you did yesterday, and eat your fruits and vegetables. And you know what? I knew that before I started. All right. Next, we're going to be talking about age-related changes in our muscles. So from the time that you were born until about age 30, your muscles are going to grow larger and stronger. However, at some point in your 30s, you start to lose muscle mass and function. Now, of course, this could occur sooner if you're not intentional about being active or if you have some underlying health condition. However, as we age, it's important to understand that there are a million little things going on within our bodies that are going to impact our overall health. And therefore, it's going to be really important that we're very intentional. So, for example, what are some of those million little things? Okay, here you go. Our muscles lose size and strength, which then can contribute to fatigue and weakness and reduce tolerance to exercise. That whole adage, use it or lose it, right? This reduced tolerance to exercise can be caused by a number of factors working in combination, including the fact that our muscle fibers reduce in number and shrink in size. Plus, our muscle tissue is replaced more slowly, and our lost muscle tissue is sometimes replaced with a tougher, more fibrous tissue. And there are changes in our neurological system. And the nervous system causes the muscles to have reduced tone and ability to contract. So they're just not working as well as they used to. So bummer, right? Both genes and environment can lead to the changes in our cells that cause aging muscles to lose mass and strength, to become less flexible. However, being intentional and making strenuous activities a part of your daily life can help slow that process down. But here is something, a little tidbit that's kind of interesting. More than 1 in 3 adults over the age of 50 are not meeting their daily recommendations for protein. So again, thinking about some of those psychological or some of those, social issues why we're maybe not eating the amount of protein. And it doesn't mean go and eat like steak and shrimp and, lobster. That's not what I'm saying at all, because there are lots of foods that contain protein especially plant-based proteins, but we have to be intentional about it. All right, so changes in body composition. Maintaining a healthy body weight can be much more challenging as we age for many reasons, especially maintaining our lean muscle mass. Now, for those that are on and that are younger, keep in mind that, once you are age 60 plus, weight loss means something different for them than it does for younger individuals. And our goal, again, and my focus would probably be age 60 plus, the goal is to decrease the rate of age-related sarcopenia or age-related muscle wasting. And you can do this by, again, being intentional about being physically active and doing those muscle strengthening activities, and making sure that you're consuming adequate amounts of protein. Interestingly, inactivity is a primary reason for muscle loss. Physically inactive people can lose as much as 3 to 5% of their muscle mass each decade over the age of 30. Even if you're active, you're still going to have some muscle loss. So keep that in mind. And you're like, wait, so you said I have to be active, but I'm still going to have muscle loss. So that means I have to be extra active? Ding, ding, ding. Correct. You really, really have to be intentional about getting that activity in. Now, there's no test or specific level of muscle mass that's actually going to be diagnosed for sarcopenia. However, any muscle loss matters. And that's because when we lose muscle, we are losing strength and mobility. And when you think about that muscle loss, so, I take classes at the YMCA, I work out pretty intensely, and some of my coworkers, they're like, there's no way I would do that. That just sounds terrible. But here's the thing. There have been times where I have almost fallen and caught myself in the presence of my coworkers. And they're like, wow, you were so graceful in how you did that. Of course, in my head, I didn't think I was graceful. I was embarrassed, but I was like, oh, thank you. And I really attribute it back to the fact that I work out, I lift weights, I get my cardio in. I always joke that, I run, or actually I jog. If I was running away from a bad guy, they'd probably catch me. Yeah, but I'm doing that activity, and it helps with your reflexes. So again, if you're 60 plus and you're working to maintain that muscle mass and you were to fall, you can catch yourself. The other thing that's important to acknowledge and understand is that physical activity improves your gut health. And that in and of itself is like a 2-hour class. But yeah, so you might be thinking, I wanted to learn more about nutrition, and she keeps talking about physical activity, and that's because they go hand in hand. Sarcopenia typically is going to be accelerated around age 75, but it can speed up as early as 65 or even as late as 80. So again, I think it really makes a difference in what your baseline activity is and how you're maintaining that. And when you are working to maintain and prevent muscle loss, you are reducing the likelihood of falls and fractures, because you can have that increased reflex time and catch yourself so that you don't necessarily fall. Plus, loss of muscle contributes to decrease in coordination, difficulty with balance, and essentially loss of flexibility. Now, a little bit more about muscle loss. So again, this is something that's really, really important. Muscle loss can be caused by a decrease in our body, or it is caused by a decrease in our body's ability to make protein, a decrease in hormone production. So again, as we're aging, our body isn't breaking down and metabolizing, making new protein the way it once did. We have changes in our hormones, especially our growth hormone. We have age-related reductions in our nerve cells that are responsible for sending the signals from the brain to the muscle to initiate that movement. That's another important thing. By being physically active, you know, you're helping to maintain those nerve cells, again, that are going to say like, oh my gosh, I'm tripping, I'm falling, I'm gonna catch myself. And you know, maybe you fall gracefully, maybe you don't fall at all. And there, you know, there's a number of factors working together that contribute to that muscle loss. And so making sure that you are aware of and being intentional about doing all of the various things. The other thing to know is that when you are losing muscle, often is going to be replaced by fat tissue. And fat tissue, or adipose tissue, is going to burn fewer calories because it's less metabolically active. And fat tissue builds up towards the center of our body. And that includes the buildup in our internal organs, which is really unhealthy for us. As well as that layer of fat that gets underneath our skin, that actually becomes smaller. And so weight loss later in life is partially due because that fat replaces our lean muscle tissue. So I remember several years ago, maybe 10 years ago now, my mom was very excited. She had lost weight, but when I looked at her, I was like, she's losing muscle. Like, I could just tell by the way her body was changing. And all of us, I'm hoping, that are on this call today have been around long enough to know that, you know, you can weigh the same amount, but our body looks different, or our clothes fit differently. So anytime that we have muscle loss, there's going to be a consequence, because loss of muscle means loss of strength and mobility. Muscle loss, you know, we can lose the size and strength of our muscles as we get older, which then can further contribute to fatigue and weakness, and reduced tolerance to physical activity, so decreased mobility. So you really have to push yourself. Aging also impacts our digestive system. Your digestive system moves food throughout your body through a series of muscle contractions. So think about squeezing a tube of toothpaste, and these contractions push food along through your digestive tract. And as we age, this process sometimes slows down, and this can cause food to move more slowly through the colon. And when things slow down, more water is absorbed in the colon from the colon, and that can contribute to constipation. What? Who knew? So a little bit about myself, because I think having a story and connecting with people, it really helps us to kind of like connect the dots. So I have digestive issues, and finally, one of my GI doctors just told me, you just have a really slow digestive system, and that's just something you have to work with. And I was like, oh, okay. You know, and so if you think about it, and again, kind of going back to the muscles, you know, and the muscle loss. So, and this picture is a really good picture. So think about all of the tiny little muscles that help you breathe, and you can hopefully visualize it because you can kind of see the ribs in this picture. So when you're losing muscles, especially if you have COPD or some type of respiratory issue where you have difficulty breathing, and you're losing muscle, you are losing those little tiny muscles that help your lungs move in and out. right? So that's not what we want. When we talk about our digestive system and we talk about losing muscles, we're losing some of the function, remember those nerve cells, some of the muscle that helps with that peristaltic action to move the food through our digestive tract. And so hopefully that kind of helps you to connect the dots and understand like, oh, wait, you know, maybe your loved one is active. Maybe they are drinking lots of water. Maybe they are eating lots of fiber, but they're still having issues with constipation. Super frustrating. But, unfortunately, you can't do any exercises to make those little muscles go faster because we don't have control over those. But it might give you a little bit more peace of mind. The other thing I want to talk about is diverticulitis or diverticulosis. About half the people age 60 and older have diverticulosis, and this occurs when small pouches in the lining of your colon bulge out along the weak spots of your intestinal wall. And while some people don't have any symptoms, such as gas, bloating, cramps, and constipation, others do. And so when I worked in healthcare, and I worked in a variety of capacities of healthcare for almost 20 years before coming to work with Extension, one of the doctors that I worked with told me, if you live long enough, everyone's going to have diverticulosis because that's just the nature of the human body. Things get worn out. And so eating a diet rich in fruits and vegetables are going to give you the fiber that is going to help decrease the risk of diverticulosis because it's going to help things move through much more easily. Additionally, we can have issues with decreased absorption of our vitamins and minerals, and this commonly occurs in our small intestines. And that's because there are, again, changes occurring that impact our ability to absorb vitamin D or vitamin B12 and even calcium. So if you're thinking, well, I take calcium twice a day, but do I really need to take it twice a day or should I just take it once? And the answer is yes, you need to take it twice a day and keep taking it twice a day because your body can't necessarily absorb it all. And by taking it, it will help you to, get as much as you can from those minerals. So age-related changes to the bladder and our urinary tract system. So again, a lot of different things are changing as we get older. And I'm like, someone should have told us about this. But then I think, it's so fascinating that maybe it's better being surprised. I'm not quite sure. We could take a poll. But yeah, I'd be curious to know what you guys think. All right, so both women and men can become incontinent from neurological issues or birth defects. They could have a stroke, they could have multiple sclerosis, or there could be physical problems associated with aging that's going to contribute to urinary incontinence. Incontinence can occur when there is a problem with the muscles and nerves that help hold and release urine. And so our body stores our urine in our bladder, and our kidneys remove the urine from the blood. And during urination, the muscles of the wall of the bladder are going to contract, forcing the urine to come out of the bladder and into the urethra. And at the same time, that sphincter muscle surrounding the urethra will relax, letting urine pass out of the body. And you're like, ew, did I really need to know that? And the answer is yes, you did, because it helps you to understand all of the different processes that are involved and why some individuals can have urinary incontinence. You could have, age-related issues to your neurological system. Again, those nerves, those muscles are not sending and receiving the messages to the brain like you had thought or hoped it would. And if you have that incontinence, your bladder muscle could all of a sudden decide to contract, or the sphincter, isn't working to hold everything back. And then you can have an issue. So there could be a lot of different reasons why you have urinary incontinence. If you're male, you could have an enlarged prostate, and gradually over time that creates additional pressure on the urethra. And then that can, cause frequent urination. But over time, the bladder muscle may gradually become stronger and thicker, and it becomes overly sensitive, and it begins to contract even when only small amounts of urine are present. And again, that can contribute to that urinary incontinence. Here's something that's interesting. Obesity. Obesity is associated with increased abdominal pressure, and that can put additional pressure on your bladder, on your urethra, on that little sphincter, and it can worsen incontinence. The good news with that, if you lose weight, that can reduce the severity of the incontinence. May not necessarily make it go away 100%, but it can at least reduce reduce the severity of it. One other thing I want to say about urinary incontinence, and it kind of goes along with it, is UTIs. When I worked in a long-term care facility, a lot of times we would have residents that would, and it was a locked dementia unit in particular that I'm thinking of. They would, they were happy-go-lucky, but if they kind of started acting up a little bit, and we would wonder like, oh, I wonder what's going on. And over time, I realized, and the nurses helped me to know this, is that, well, let's look and see if they have a UTI, because that could contribute to behavior change. And if they have poor fluid intakes, they're not drinking as much as they should, that can contribute to a UTI. And a lot of times in the summer, you see an increased number of individuals with urinary tract infections or bladder infections. In part, that can be due to mild dehydration because individuals are not drinking adequate amounts of water. Kind of going back to constipation. If you have, again, it was a locked dementia unit, we would have individuals that would kind of become a little bit more agitated. And then the nurses would do some checking. Oh, they haven't had a BM, a bowel movement, in a while. And so they're constipated. So they're kind of acting up. So again, if you are addressing someone, a loved one or a patient, and you're kind of wondering, okay, why are they engaging in this behavior? Why are they acting this way? Well, you have to take a deeper dive and look at their overall health. So keep that in mind. So each and every body system is going to be impacted by the aging process. Our eyes, as we age, you can have difficulty focusing on objects that are close up. You might be more sensitive to the glare of the light, or trouble adapting to higher levels of bright light. You might have difficulty seeing in dim lighting. Some individuals just need to have more light. Aging can also impact the lens of your eyes, causing it to become cloudy, and this would be known as our cataracts. Hearing, your hearing can become diminished as you age, and you might have be able to hear different high frequencies or low frequencies, but age-related hearing loss is a normal process. You could have mouth or teeth pain. There could just be normal wear and tear on your teeth. For the most part, our teeth are resistant to cracks and chips. However, over time, if you've had fillings or root canals, those teeth can become much more susceptible. We can have a dry mouth, and that can increase the risk of decay or gum problems. If our gums become inflamed, gingivitis is a risk factor for heart disease because they're all interrelated. If we are having issues with dry mouth, or if your loved one isn't drinking enough, they can end up with dry, cracked lips, and that can become painful. They could have a decrease in their taste buds because, let's face it, everything wears out, including our taste buds, and therefore things don't taste the same. And so maybe they never really ate a lot of sweets previously, or perhaps they never ate really salty foods, and you find or notice that your loved one is just putting excessive amounts of salt on things, or adding sugar to things that leave you scratching your head like, why are you adding sugar to that? That already has a lot of sugar, but they just can't taste it. So when you think about how eating is very much a sensory process, and if you have a dry mouth and therefore you're not able to taste the food the way that you once did, you can lose that desire to eat. If you can't really see what you're eating, maybe it's not going to be appealing that it once did. And so all of these small, tiny little insignificant, subtle factors add up. Again, we have that snowball effect occurring, and that once delicious meal that had pleasant aromas no longer is going to entice the individual. If you are in a room and you cannot hear or engage in social conversation while eating, that can be a deterrent. Like, well, I used to go and eat not necessarily for the food because I enjoyed the social interaction, but I can't hear anymore. So there really is no social interaction. So why go to the dining room? If you're in a long-term care facility, or, if you're visiting with someone, or if it's hard to coordinate eating and swallowing because you're having difficulty breathing. Again, lots of things going on as we age. If you have a decrease in taste and smell, that can lessen your interest and your enjoyment in eating. Because really, if you think about it, most people do not eat because they're hungry. I think here in our Western society, where we're abundantly blessed with plenty of food, most people eating is more social. All right, aging effect in your skin. So the effects of aging on your skin is more than simple wrinkles or age spots or the growth of skin tags and whatnot. Below the skin surface, you're going to be losing fat in your cheeks, your temples, your chin, your nose, the skin around your eyes may become loose, and your face can develop a leaner look to it. And if you lose bone around your mouth and your chin, the skin around your mouth can pucker. So again, think about comparing a loved one's picture from when they were in their 20s and 30s to what they look like now. And you're like thinking maybe, well, how did all that change? But, we talked about bone loss. So maybe you're thinking bone loss like, in the legs and arms, but it actually occurs throughout our entire skeletal system. So again, we can be losing bone in our mouth and chin, and that can cause us to have that puckered lip or look. But it can also, the changes in our skin can also cause that. So even the nose can change if you're losing cartilage. And of course, gravity plays a role. And when the skin becomes less elasticity, The gravity makes eyebrows and eyelids droop, and it creates looseness and a fullness under the cheeks, kind of giving us that jowl or that double chin. We can even have length in our earlobes. Again, there's lots of different things going on. When it comes to our skin becomes slack. There's a loss of that elastic tissue. And that's simply because of the aging process. So it's going to kind of hang a little bit differently. I think for me, I've noticed this more in men. And I think put your shirt back on. We don't need to see that, right? Maybe in your 20s when you had, a six pack and some amazing pecs and arm muscles, but now put your shirt back on, right? Yes, you're still at a great weight, but things just don't look the same. So bone loss, mostly around the mouth and chin, becomes more evident after age 60. Cartilage loss in the nose, again, can cause that drooping of the nasal tip. So like, I don't know if you can see the tip of her nose right there. And the loss of fat below our skin, especially in our cheeks and our temples, it can kind of give us that sunken or skeletal appearance that you notice in older individuals. Additionally, the sebatic keratosis may be one of the most common benign tumors of the skin. And there's a lot of different small lesions that can develop. Many of them are non-cancerous, but they're just lesions that occur. I went and saw the dermatologist about this one little freckle, and the doctor's like, oh, she gave me some big name for it. And she's like, those are genetic. Do people in your family have those? I was like, well, yeah, you'll just keep getting them. And I was like, well, that's not what I wanted to hear, right? So, our skin becomes dry. Like no amount of lotion that you put on is going to like get rid of some of that dryness. And I'm just like, I'm gonna keep putting lotion on. I just put lotion on, right? But it does help. And so it's all about prevention, doing the small things to help, have a better quality life. So think about those things. All right, brain and our nervous system. Yep, guess what? This is impacted by aging too. As we age, nerves may conduct impulses more slowly, resulting in a decreased sensation or slower reflexes, and sometimes give us that clumsy appearance. Nerve conduction can slow because of the myelin sheath around the nerve becomes degenerative. And this myelin sheath, in the myelin sheath are layers of tissue that insulate the nerves and the speed of the conduction impulse. So in this picture up here, you can see that myelin sheath, and it branches out into the nerve conductors, and that just really slows down. And so as you age, your brain and nervous system go through natural changes, and the brain and the spinal cord lose nerve cells, and they kind of atrophy. Our nerve cells may begin to kind of pile up and just really not work the way they once did. Plus, we have decreased blood flow, especially if we have any type of heart issue. And so if those nerves aren't receiving the blood that they need, they're not going to be maintained. And then all of this then can contribute to a decrease in sensation, because we're not getting the nerve feeling. Or if you have uncontrolled diabetes, or poorly controlled diabetes, or poorly controlled blood pressure, you can end up with neuropathy. Many years ago, my grandma had been sewing at her sewing machine, and she dropped a needle, and that was in the morning. And then in the evening, my brother had stopped by, and she asked him if if he could find the needle she had dropped on the carpet. And so he gets down on the floor and he's looking, and he turns his head and looks at her foot. He's like, "Grandma, the needle's sticking out of your toe." She'd been walking around the whole day with a needle in her toe and she didn't feel it at all. And she did have diabetes, and it probably wasn't the best controlled. But yeah, so it's really, really important that we're working to take steps to make sure that we are maintaining our blood sugars, maintaining our blood pressure, working to be active to help increase blood flow throughout our body so that our nerves can get the nutrients that they need. Your brain and spinal cord lose nerve cells and weight essentially. And so we can have a compressed vertebrae, and that can put pressure on our nerves, and that can further contribute to having a decreased sensation, decreased strength, and it impacts our balance. So again, all of these things that happen as we age, right? Okay, here is another sad part, but I'm guessing most of you probably already know this, or some of it. Certain parts of our brain shrink, especially the prefrontal cortex. So that's the area at the front of the frontal lobe. So certain parts of our brain shrink, especially the prefrontal cortex and the hippocampus. Both areas are important for learning, memory, planning, and other complex mental activities. So if you are listening today and your great grandchildren have been trying to teach you how to use a smartphone and it just does not seem to be sticking, and you get it some of the time, but not all the time, don't feel bad, because again, our brains are slowly shrinking, right? And so not that that's going to be an excuse, but I always tell my parents, write notes, write it down. I don't want to have to tell you 100 times. I can tell you 50, but not 100, right? So write it down. The slowing of thought, memory, and thinking is a normal part of aging, and that's okay. And these changes are not going to be the same for everyone. Some people have many changes in their nerve and brain tissue, while others only have a few changes. These changes are not always related to the effects of your ability to think. Dementia and severe memory loss are not a normal part of aging, and they can be caused by brain diseases such as Alzheimer's, Lewy body dementia, and other forms of dementia. And it's associated with the plaques that can form in the brain, or the different tangles forming in the brain. And I'm not a neuroscientist, so I'm not going to go too far into those weeds, but the nice thing is that there are factors that influence our brain health. Lifestyle, incredibly important. Our overall quality of health, like, are we managing our blood sugar? Are we managing our blood pressure? Are we managing chronic kidney disease or asthma? What type of environmental factors are we being exposed to? What are our genetics? There are certain forms of dementia that are very much tied to genetics. As an individual whose father has Lewy body dementia, it is something that shouldn't be taken lightly. But age-related memory loss, age-related challenges that we face with planning, trying to learn new skills, some of that's just age-related. However, with that age-related memory changes, given enough time to think about the answer, patients or loved ones generally are going to remember. So that's the good part. You know, it might take a day to remember. I've had conversations with my mom and she gets frustrated. Oh, I just can't remember, right? And then she calls me up the next day. I remember, right? So that's just age-related memory changes, and that's okay. So yeah. All right. So what does all of this mean? It means that getting old is not for the faint of heart, as my dad would tell me, and that age matters. We all age differently, and there are things that we can all do to age more gracefully and live a healthier life. But it really takes a lot of intentionality. Remember, as we age, there are many factors that we are going to be faced with. And we're going to have nutritional challenges. And we've already talked about these. So you might be thinking, what can I do? It really comes down to prevention. And there are several things that you can do to help manage or prevent age-related changes from occurring. Obviously, you won't be able to prevent all of them, but by being physically active, by eating healthy food choices, by having healthy stress management practices, by talking to your healthcare provider, by intentionally cooking from scratch, having positive social connections, all of these things, setting goals, working to reach your goals. All of these things are going to help us to age well. So addressing common issues related to age and nutrition, dehydration, difficulty chewing and swallowing, skin, chronic health conditions, weight loss, and cognitive decline. These are the 6 that we're gonna touch on. And so staying hydrated. Our bodies are primarily made up of water, and water helps regulate our body temperature. It helps us to digest our food. It participates in the metabolic reactions within our food, our body. It aids in the removal of waste, and it helps to lubricate our joints, the inside of our eyes, and our spinal cord. And therefore, it's going to be really important that we're intentional about getting adequate amounts of fluid. So again, what factors influence our need for water? Well, just like there's many factors for our calorie needs, there are many factors that contribute to our need for fluids, our body composition, our activity level, our diet, environmental factors. Is it hot and humid, or is it dry and arid? The other, when we talk about diet, 20% of the fluid that we take in comes from the food that we're consuming. So if you have a loved one who doesn't want to drink water, maybe you can give them watermelon and cantaloupe, because those are very high water content food items, and they may be more likely to eat that versus, have extra glass of water. Now, primarily 80% of our water does come from the beverages that we drink, but there are ways to get additional water into the lives of your loved one. Thirst influences water intake in response to changes in our senses, that can be impeded. So if, we don't necessarily recognize our need for fluids, if we're taking medications, especially a diuretic, if we have a chronic health condition, maybe we're on a fluid restriction. So again, all of these different factors come into play in how it impacts our overall fluid needs. So how much water should you drink? Well, I would love to say, oh, you need to drink 8 ounces, 8 glasses a day, but that's not really how it works. So a really good rough indicator of hydration status is the color of your urine. If your urine is a dark amber color or has a strong odor, you may not be drinking enough water. If you're passing urine that's colorless or a pale yellow, at least 4 times a day, that means that you're getting enough water. Now, of course, if certain medications can impact your urine color. If you have a colored toilet, you can't necessarily see what color your urine is, but really aiming to have that light colored urine is really going to be important. Again, keep in mind what water does. It helps remove waste from our body. It helps in the metabolic reactions. It helps regulate our body temperature. And I always like to toss this out for food for thought. And maybe someday someone will be like, oh, I listened to your presentation and did my research project around it. My thought is, I feel like older people are always saying that they're cold. But I also feel like older people don't like to drink water or fluids. And I would like to know if they drank more water, if they would be less cold. Right? Isn't that a great question? It's going to be really important that you're working with your loved one to make sure that they are not becoming dehydrated. We've been talking about factors that can increase or decrease your risk for water. What happens if you become dehydrated, if you're not getting enough water? Because you can't always rely on thirst as an indicator for a water deficit. And that's because thirst lags behind the body's need for water, and it doesn't remedy a water deficiency quickly. So even mild dehydration can cause weakness, dizziness, and even fatigue. Now, if you have a loved one that has, a fever, vomiting, severe diarrhea, if they're on a lot of diuretics, or if they're engaging in strenuous physical activity, that can contribute to dehydration. So you need to know what those signs are. So if someone has a headache, muscle weakness, they seem irritable or really drowsy, if they have dry, flushed skin, a dry mouth, dry tongue, even if they have cramping in the legs and arms, those are all indicators that they could possibly be dehydrated. So work with them to make sure they're getting extra fluid. All right, the normal aging is also associated with the shrinking of the brain and that diminished nerve function and a decline in the muscles used for swallowing. Who knew, right? So if you have issues with swallowing and chewing, you really need to talk with your healthcare provider. There are over 30 muscles involved in the swallowing process, as well as all of the nerves involved in that chewing and swallowing process. So you may need to have a swallow study done. Anytime you have difficulty swallowing, you may have dysphagia, and that simply means that it takes more time or effort to move the food in your mouth and down your throat, or you could have issues with liquids as well. One way that you can help if you have chewing or swallowing problems, taking a drink after you take a bite to help that liquid move that food bolus down your throat. You can add additional sauce or salsas to food to help moisten it. If your loved one has had a swallow study and has been told they need to be on mechanically altered foods like pureed or chopped foods, make sure that you are following those recommendations. Too often, I would see loved ones come in or family members come in and their loved one would be on maybe a pureed or a thickened liquid. And the family would think that would be terrible and sneak them food. And then the next thing you know, or sneak them a liquid. But then all of a sudden they would end up with aspiration pneumonia. Oh, I don't know how that happened. Oh, okay. But thin liquids like water or milk or juice, those are really hard to control if they've been thickened under the recommendation of a speech language pathologist. That can help your loved one get the nutrients that they need. Perhaps they need to see a dentist. It's important to make sure that their dentures are fitting properly. Again, you could have bone loss in the jaw, and that can impact the ability of the dentures to fit properly, and that can contribute to difficulty chewing and or swallowing food. All right, when we're looking at the skin and we're talking about aging and nutrition, the skin is something, it covers our entire body, but our skin becomes very fragile as we age. And so nutritionally, it's important to maintain your skin by consuming adequate amounts of fluid, adequate amounts of total calories, making sure you're getting the recommended amounts of proteins and getting foods that are rich in vitamins and minerals. Making sure that if your loved one has bowel or bladder incontinence, that you are changing them very quickly. Stool is very acidic, and that can cause the skin to break down very, very quickly, and even in some situations kind of burn the skin a little bit. There could be micro tears in the skin, and bacteria can get in there, and that bacteria then can lead to an infection. Or having moisture on the skin for a prolonged period of time can also then contribute to the skin breaking down. If individuals are smoking, I would encourage them to stop smoking. Smoking contributes to the reduced blood flow. It also limits nutrients and oxygen to our skin cells. And you might be thinking, really? And the answer is yes. And that's just like the short version. It's much more complicated, but for the sake of our presentation, yeah, smoking does contribute to a reduced oxygen and blood flow and the nutrients getting to the cells. It's also important that you are mindful of how long your loved one is sitting without moving around, because that prolonged pressure can contribute to bed sores or pressure sores. How you transfer your loved one also makes a huge difference. If there's friction, friction's the resistance to that motion. If you're trying to scoot them on a towel or a bed sheet, that can cause their skin to tear. Again, keep in mind their skins can be very fragile, especially if they're on certain types of medications. And simply the aging process as well. Chronic health conditions. So, aging is a major risk factor for many diseases, such as, again, cancer, heart disease, neurodegenerative diseases like Alzheimer's and Parkinson's. And these diseases and their medical treatments can decrease appetite. It can interfere with normal eating and affect how our body uses the nutrients that it is getting. It can also sometimes cause individuals to actually need more nutrients, maybe not necessarily total calories, but more nutrients. So if you have a wound, you need additional nutrients. If you're vomiting and have diarrhea, you need to replenish your body. If you're on oxygen and you have difficulty breathing, it's hard to coordinate the eating and swallowing factors that come into play. If you're oxygen dependent, that can contribute to having a dry mouth. And then that dry mouth can further exacerbate any issues with your teeth. It can, increase the risk of dental caries and bacteria within the mouth, difficulty chewing or swallowing. And then, of course, if you have cognitive changes, if your loved one becomes agitated at mealtime, if they have some form of dementia and have sundowners where they become more agitated, late afternoon, early evening. And so you can't really have them sit at a table and eat. So finding a way like, okay, well, let's, maybe they're up all night till like 3 or 4 o'clock in the morning, just because they're busy. So maybe having their dinner meal, their evening meal, not between 5 and 7, maybe waiting until like 12:30 at night, because that's when it works better for them. If you have individuals that have increased wandering, again, some dementia, some individuals that have dementia are very, very busy, and they're always wandering or looking for something to do. And so if they have that, they have increased activity, yay for maintaining their muscle, right? Their muscles and joints. However, they're burning additional calories, and they may not necessarily want to be eating to replace those calories. All right, the other thing I want to talk about is that weight loss and aging. Weight loss is not the same in older adults compared to younger adults. For the most part, that's because as older adults, as their bodies are changing, they're actually losing muscle mass. And it's being replaced with fat tissue. And that loss of muscle mass then leads to decreased mobility, decreased functionality. And another issue is it could be these weight changes or weight fluctuations could be due to fluid changes based on edema. So perhaps their kidneys aren't working as well. Maybe they have chronic kidney disease. Maybe they have congestive heart disease. And so they're retaining fluid. And so here I have this picture. The first picture is of a normal foot and ankle with no edema. And then the last image you can barely see that ankle and that heel bone because it's just so full of edema. The top of the foot has become very swollen with that edema. And so, watching for those fluid changes, because when you have a lot of fluid on board, that's going to impact their blood pressure. That's going to impact their renal function. That's going to, maybe contribute to shortness of breath because their heart's having to work harder to pump all of that extra fluid throughout their bodies. Cognitive changes. So we have kind of touched on cognitive changes already, but apraxia is the inability to perform physical actions despite having intact physical ability. With apraxia, people may not know what to do with their spoon or their fork or how to chew or swallow once they have food in their mouth. And so giving them those cue to action. So, they can do it. They have the ability to perform that activity, but you have to tell them what to do. Put the spoon in your hand, put the food in your mouth, chew your food, swallow your food. So giving them those cues. Agnosia is the inability to interpret sensory information such as smell or taste. And so they may not be able to recognize that they're hungry. And so, maybe your loved one's still at home and you ask them, hey, do you want something for breakfast? Nope. Okay. Well, hey, do you want something for dinner or for lunch? Nothing. All right. Well, it's bedtime and you haven't eaten all day. You have to eat something, and so you have to kind of intercede for them and help them to say like, okay, well, it's time to eat. I realize that you're not feeling hungry, but let's go ahead and, maybe give them a nutritional supplement. There can also be changes that occur where they have decreased self-awareness or decreased self-regulation. So one thing that I've noticed with my dad in particular, growing up, he was not a sweets and treats kind of person. And he didn't want us to be sweets and treats kind of people. But if you were to put a plate of cookies in front of him and give him one cookie and then just like wait, he would just reach over and take another cookie and then eat that cookie. And then he'd reach over and take another cookie and eat that cookie. And you're like, wait, he's never really done this before, so you have to, help them regulate because they've lost that ability to self-regulate. And a lot of times they lose that self-awareness. So again, being there to safeguard them. Sometimes individuals have unsafe behaviors when eating or cooking food. So again, if your loved one cooks, they're at home alone and they will forget to turn the oven off. Or maybe you go to their house and you notice the hot pot holder, the hot mitt got burnt and you're like, oh, what happened? Oh, well, it caught on fire the other day. And you're like, what? So, evaluating, okay, is this something that we really want mom or dad to have access to, the stove? And then of course, there's socially inappropriate behaviors. So maybe you find your loved one taking food from other people's plates, and you're like, what is going on? But again, that in a sense, like on the locked dementia unit that I worked on, that was everyday normal activities that could be expected if you came to that part of the building. And the other people would usually be okay with it. There really wasn't an issue. Of course, you try to redirect, but sometimes that's just how it goes. So again, a lot of different things occur as we age. But let's see if I covered everything that I thought we'd talk about. We talked about why nutrition is important as we age, and a lot of the many, many wonderful and surprising changes that occur. We talked about how these nutrition changes impact our nutritional status. And then we also talked about some of the common nutritional issues that we see: dehydration, difficulty chewing or swallowing, chronic health conditions, weight loss, and cognitive decline. So with that, I'm going to say thank you for sticking through. And does anyone have any questions? I'm going to turn the presentation back over to Tammy.
Okay, Diane, thank you so much for your thorough and insightful presentation. It was awesome. There was so much information that I think is going to be useful for our audience. There was definitely a lot of tidbits and information that was helpful for me. So I just want to thank you for preparing such a wonderful presentation for us today. We do have some questions, so I'm gonna go to the Q&A, and let's see. Any recommendations for older adults, let's say 75 years or older, with heart conditions that are trying to follow a plant-based diet to get all of the essential nutrients that they need?
At the end of the day, I always defer back to your primary healthcare provider because they're going to know your unique individual needs. However, the Mediterranean diet is really one of the best diets out there. It's very high in fruits and vegetables, and you can get your plant proteins. And so I would encourage you to check out the Mediterranean diet. There's lots of research that supports it, but just know that there is no one Mediterranean diet. There are many variations. So find out which one works best for you.
Okay. Could you give some examples of nutritious snacks for older people?
Okay, well, so when you talk about nutritious snacks for older people, they kind of fall into a couple different categories. So, one of the questions I would ask, like, is it just a healthy snack that you're looking for? So like fruits, vegetables, maybe some hummus with some vegetables. Or are you talking about someone who you are trying to help them maintain their body weight because they're dealing with weight loss and they're just really not a good eater? Because if you're talking about that particular group or category of individuals that can't maintain their body weight, that are just really bad at getting the nutrients that they need, they may need nutrient dense foods. So they might need like a protein powder shake or smoothie or something special. So it kind of depends what category that you're talking about. Like, what is their overall health goal or status? Um, so unfortunately, there is not like a simple, easy answer, but if you're talking about a relatively healthy individual who's just looking for a healthy snack, I would just encourage really those fruits, vegetables, a small portion of nuts if they can chew or tolerate them, um, hummus, trying to cottage cheese with fruit. I mean, kind of a protein, but again, I'm not going to say, oh yeah, eat cottage cheese. And you're like, oh my gosh, no way, it's gross, or it's really high in sodium. So I can't eat that because we're trying to limit the amount of sodium. So you really kind of have to know like what particular health issue the individual is dealing with in order to really give them sound advice.
Okay, gotcha. And then what about vitamins and mineral supplements? What is safe number for, let's say, a 90-year-old? Is 10 to 12 vitamins too much? I know like when we go into like Walmart, you see there's a whole shelf full of A to Z vitamins,
Yeah.
and fish oil, and all of that. What would you say is a good amount of vitamins, and would that also depend?
Yeah, so that again, I have to defer to your healthcare provider and your pharmacist.
Mhm.
They're going to know what specific medications that you are already taking. I can tell you that, over the years when I worked in healthcare at the hospital, our patients that would be admitted, we would give them calcium and vitamin D and a multivitamin. Now, and so those were always like the basic. Um, and you have to be careful when you're getting nutritional supplements. I always say stick with the tried and true brand names because some of them you could have drug nutrient interactions. Some of them don't actually have the active ingredients that they're claiming to have. So you really do have to be careful because they are not regulated by the FDA. So, talk with your pharmacist because they're going to know what medications you're taking, find out what their recommendations are. But, calcium, vitamin D, and I mean, calcium and vitamin D are sold together, they're packaged together, but an additional vitamin D and your multivitamin. That's a basic general safe recommendation.
Okay. And are soy products a safe source of protein for the elderly with no major health problems?
Yeah, so soy proteins are a great plant-based protein. You do have to be cautious about any additional amounts of sodium. Sometimes like our soy burgers or, sometimes they have a lot of additional sodium that has been added to them. So
Mhm.
look at the sodium content. The recommendation is to limit your sodium intake to no more than 2,300 milligrams of sodium a day. Um, However, if you have um, other chronic health conditions, your healthcare provider may recommend a lower amount. So just when it comes to soy product or any additional supplement, check it for the sodium content.
Okay. I remember you saying that a lot of times we go towards proteins like, steak and beef and meat.
Yes.
We are trying to get proteins. I know I do that a lot. I'll say, well, at least let me get some chicken or turkey or something like that.
Mhm.
What are other, besides soy, some other plant-based proteins that we can go to besides, meat products?
Yeah. So if you look at your nutrition facts label, it will tell you how much protein is in certain foods. So, like, I actually don't like cottage cheese, but cottage cheese is really high in protein. So, cottage cheese, yogurt, like your low fat yogurts, um, kidney, like if you like to eat meatless chili, any of your like legumes and beans, they all have protein plus fiber plus their B vitamins. So those are a great option. Now, I'm not advocating to go 100% meatless, but just, sometimes I talk about making sure you're getting adequate protein. And then all of a sudden you hear like, oh, I ate a 6-ounce sirloin. And I'm like, what? So knowing what you need, and then, making sure that you're choosing wisely in the protein choices that you have. I mean, peanut butter has protein, but it's also high in fat, so making sure that you're finding that balance. Yeah, protein drinks. I know protein powders and drinks are super popular. Milk has protein. So it really depends on your likes, your other health needs, and then just taking the time to be intentional and looking at your nutrition facts labels.
Okay. And then we have another question from someone who wants to know how to approach aging parents on the topic of their diet.
Well,
He says that they resorted to diet sodas. A lot of people think that diet is good, right? Diet sodas, frozen vegetables, and ice cream. And as you said, eating a cookie is much easier than actually cooking a meal or
right.
bag of
So
chips.
yeah, so I would have to, I have been having the healthy eating conversation with my parents for probably 25 years. And so, and I do little nudges, because at the end of the day, they're grown-ups and they're going to do what they're going to do.
Mhm.
But if they come to my house, I'm going to serve them healthy foods. If I'm shopping for them, I'm going to buy healthier food options. If they're not at the stage yet, but if they were not eating or preparing their meals, I would, prepare meals so that they would just have to put them in the microwave and warm them up. So it kind of depends, like what stage of assistance that they need. If you're, in your 30s and your parents are in their, late 50s and you're having these conversations, it's going to be like more nudges and encouragement and, a lot more nudges and encouragement, I think.
Okay. Can you recall any types of nutrients or foods that are good for wound healing?
Yeah. So, again, you have to check with your healthcare provider. But if you're diabetic, the glucerna shake. And really, if they're asking about a wound, I would encourage them. They're probably working with the wound clinic. And I was a consulting dietitian for the wound clinic, and our wound clinic had specific packets of nutrients that they recommended. And typically they had to go through their pharmacy to get them. But if you have a wound and it's healing and it's draining and you have a wound back and everything, you're losing protein and all that liquid that's coming out. So you need to make sure that you're taking, your Ensure shake or Glucerna shake or your Premier Protein or Carnation Instant, but whatever they have recommended for you. Plus, if they're recommending like arginine powder, again, it's going to be very specific to the individual and their health need.
Okay. And then besides watermelon and cantaloupe that help replenish water, are there other fruits or vegetables that you think are
Yeah.
really good about replenishing?
All right. Well, are we almost at peach season? Think about a peach and you bite into and it just runs down your arm, right? So peaches and plums and cucumbers and zucchini and, yellow squash, or yellow summer squash, I should say. So any of those fruits and vegetables that when your tomatoes, when you cut into them, you're like, oh, this is kind of a watery mess, right? So think about those types of foods. Those are going to be high in, fluids. And so like my dad is not a very good beverage consumer. So I'm like, Mom, just buy another watermelon and just keep giving him watermelon. Then he's like, I don't know why I have to get up and go to the bathroom all the time, right?
Okay, I want to let the audience know that we will go over probably about 5 or 10 minutes, probably about 5 minutes. So I am going to ask Diane a couple of a few more questions. The next question is Prevagen or balance of I'm not sure if that's supposed to be nature or nurture, good benefits? She's not really sure if they're approved by the FDA, but I guess in your view, are they beneficial?
Okay, can you repeat the question one more time, please?
Is Prevagen or
Okay,
balance of nature
okay, balance it. Okay,
a benefit?
yeah. So I would, unfortunately, I am not going to like yes or no to any of those types of things. I would say talk with your pharmacist, talk with your healthcare provider to find out if that is something that is beneficial to you. And so I'm not up to speed on those, but also that's essentially kind of in a different area of expertise. So I'm going to defer to the pharmacist and healthcare provider.
Okay. And then what role do carbohydrates play in the nutrition of older adults? Someone says that their mother avoids them and she ate well all of her life.
Right. Okay. So I didn't include it in this presentation because I really kind of just wanted to focus with kind of understanding that aging process. But a lot of times over the years, I've had friends tell me, Diane, I'm not consuming carbohydrates. And I'm like, oh, you're not? Oh, tell me more. And then they're like, well, I was like, what did you have for breakfast? Oh, well, I had a smoothie at the gym from the smoothie bar. Oh, what was in your smoothie? I think there was yogurt and there might have been milk in there and ice and yeah, but I didn't have any fruit, And I was like, oh, okay. But simply them telling me that there was yogurt and milk in their smoothie tells me they don't understand what carbohydrates are, because carbohydrates are essentially the building block and the primary fuel source for our bodies. And carbohydrates are going to be found in milk and yogurt. Carbohydrates are found in fruit and vegetables. Excuse me, we have some vegetables that have higher contents of carbohydrates and some that are, low carbohydrate foods. But carbohydrates are essentially everywhere. And so if someone says that I'm avoiding carbohydrates, I really have to further ask more questions to find out what their understanding of carbohydrates are. Now, of course, carbohydrates can also be cakes and cookies and chips and white flour and white sugar and things like that. But a peach, those delicious Georgia peaches that are going to be out here pretty soon, those contain carbohydrates. Grapes contain carbohydrates. Watermelon contains carbohydrates. Milk, so all of the different foods, a lot of the foods contain carbohydrates. So if you eliminate carbohydrates, I would have to wonder what they're eating in place of that. And then I would also have to have concern about all of the wonderful vitamins and minerals and fiber and phytonutrients that they're missing out on by not eating those fruits and vegetables.
Okay, well, that is all of our questions, and we are at the end of the program. What an honor it has been to have you today, Diane. The information was so valuable and so thorough. It was so much that we got out of it. So much information on nutritional health. I want to speak to our audience and thank them so much for joining us today for this presentation and taking time out of your busy schedules to join us. We're really glad that you came. I wanted to remind you that the slides for this webinar will not be shared, but the PDF has been sent out and can be sent out. The recording also will be sent a week from the webinar. As you sign out, there will be a brief survey Please take a moment to answer those survey questions and let us know what you thought of today's presentation. This helps us to continuously provide topics in our webinars that you are interested in and that are helpful to you and your loved ones. Please join us for our next webinar, which will be on Wednesday, August 16th from 12 p.m. to 1 p.m. And the topic will be how to support a loved one living with brain injury. This session will educate caregivers on understanding brain injury and its effects on their loved ones, as well as how to cope with a sudden and sometimes life-altering injury where caregiving is unexpected and can affect their relationships, finances, living environment, and overall wellness. Again, we want to thank everyone, and we hope you have a great afternoon. We'll see you next time.